My name is Dheepan. My matric number is S68707, and my group consists which is Zharfan, Dineshwary, Aina, and one. So today we are going to present about mental health empowerment amongst students in UMT. Okay, for the introduction, mental health empowerment refers to gaining control over one's mental state through awareness, coping skills, and resilience. This equips students to manage academic, personal, and social challenges effectively. This also helps self-reliance, reduce dependency on external help, and improve overall well-being. Follow in the next slide. Okay, rationally, why mental health empowerment is important among students in UMT. Okay, first, it helps students to manage academic stress and deadlines effectively for like assignment and all. Secondly, developing coping skills to tackle anxiety and personal challenges. Thirdly, it enhances emotional well-being and help to be focused and productivity too. Then the fourth one is it helps to create supportive and positive campus environment, and it promotes self-reliance and reduces dependency on external help.
Objective. Under objective, we have a three aspects, which is social, environmental, and then economical. Under social, promote a supportive community culture. And the second one is encourage peer support and reduce the stigma around seeking help. The second one is environmental. Under environmental, create a campus environmental conducive to mental wellness. The second one is provide safe and then accessible and inclusive spaces for relaxation and mindfulness. The third one is economical. Under economical, reduce the financial stress related to academic and personal challenges.
For method in this project, mental health empowerment awareness among UNT students from different faculty, we aims to measure the mental health empowerment awareness among them. And the survey were conducted between 31 to 25 December 2024. And how we interpret the data is that we were using Likert scale method and agree and disagreement for aspect KAP aspect, knowledge, attitude, and practice. For preparation plans, it start with how we define the objectives for the survey, and we determine the platform of survey, which were the Google Forms, and develop the Likert scale questionnaire with various questions, KAP evaluation, and we launch the survey and spread it to UMT students from different faculty. And finally, we collect the data and analyze it to make the report for it. For implementation plans, the survey were available between 21 to 25 December 2024, and the question will be faced to KAP evaluation, knowledge, attitude, and practice, and Google Form will be our main platforms to develop a Likert scale question. And role and responsibilities is survey designer Aina, data recorder Dheepan, data analysis one, survey spreader Diva, and technical support Zharfan. And how we distribute the survey, we were using WhatsApp as our main platform. Itu community group like UMT students group and course groups.
Next, for the data analysis from our 50 respondents, we get that most of the respondents are male, which we can conclude that many of the male or men in UMT among the UMT students are aware about the mental health empowerment. And then from the survey, we also can conclude that every faculty in UMT contributes fairly to our survey, which we can see here. The respondent percentage contributes about 10 to 20%, and the highest respondent came from FPAPs, and the lowest respondent came from Pusat Asas System or PASTEM. We get that most of our respondents came from the first and third year student. Based on our survey on KAP or knowledge, attitude, and practice survey, for the knowledge section, we get that most of the student UMT have knowledge about the mental health empowerment. As we can see here, most of the respondents choose agree to neutral. Next, the knowledge of the student about the source and the service that are provided by the UMT, we see that most of them know about the source and services, but two of our respondents did not really know about the source and services about mental health empowerment. From the analysis, we can conclude that most of the UMT students also shows good attitude towards the topic about the mental health empowerment, and they also agree to support and give support to all the people that involved in mental health problems. Surprisingly, we find that majority of the respondents thinks that there are a lot of false information that are spread among the UMT students. This is very sad and shows that there are a lot of irresponsible person that spread the false information about the mental health, and thus shows that we still need a lot of initiative to spread the mental health awareness. The last part of our survey is practice, which we can extract the information about how the student practice on empowering mental health. Uh, as you can see here, uh, most of the students are taking part in the activities or programs related to mental health empowerment, but there is still a significant amount of people that are not taking part in the activities. The 16 respondents from our survey shows unique response. Uh, as you can see here, she, which is a female, from the fourth year, did not taking advantage of the counseling or any activities about mental health empowerment, and also she also did not really know about the source and services that are provided by our university, which is a bit surprising, even though she is in the fourth year in UMT.
Results and outcome. First one is improve mental health being. And then our survey related that increased awareness and acceptance of mental health issues can significantly improve student mental well-being. When students feel supported and understand, they are less isolated and more likely to seek help. This is a step we can working and immediately through camping, peer support programs, and open conversation.
I will explain the expected impact of our mental health empowerment campaign among the UMT students that can categorize into three key aspects, which is social, economic, and environmental. Okay, for the social aspect, our campaign aims to improve the mental health awareness by normalizing the conversation about the mental health, which can help more individuals feel empowered to manage their mental well-being, which can ultimately also improve their quality of life. So our efforts are designed to strengthen the community of the support networks, which can fostering a culture of care and support among the UMT students and community. In the environmental aspect, we are promoting the ecotherapy, encourage students to connect more with nature as a way to enhance the mental health. So additionally, our campaign supports the sustainability practice, aligning the mental health with eco-conscious lifestyle. Then finally, the third expected impact is to the economic, which it can include the reducing of long-term healthcare costs by addressing this mental health issue early on the students. So the increase will focus on mental health, could create a new job opportunities, particularly in the therapy and also for the mental health service sector.
To conclude the analysis from our survey, we can conclude that many of the students in the UMT know about the mental health empowerment, but there is still some individuals that are not knowing or taking advantage about the mental health empowerment programs that are held in our university.
So overall, our campaign show the interconnected benefits which can bring to the individual and also to the UMT community.